And months after COVID-19 arrived in the U.S., doctors are starting to better understand the long-term impacts that the disease is having on patients with both mild and severe cases.
Yeah, our Angeline McCall talked to a pulmonologist at Spectrum Health about what he is seeing.
Doctors for months have been studying a disease previously unknown, with long-term effects impacting every patient differently.
So not only you have the virus invasion of the human body, but also now the immune system and clotting factors that make very small areas in the lung clot off. So you have fluid leaking out, pus building up, clotting. That's a perfect storm.
Dr. Gustavo Cambo-Nicelli showed us these images to show what that scarring looks like. You can see where the arrows are pointing out the damage in the lungs. Here's another look at one of the most common forms of scarring. Patients diagnosed months ago with severe symptoms are still seeing lasting impacts in what's called post-COVID pulmonary fibrosis.
It's not insignificant, the amount of patients that develop fibrosis, but I wouldn't say that it's not exceedingly common.
Doctors say they're seeing long-term effects on patients of all ages.
No, I'm afraid that our younger, patients, they wish they knew then what they know now. I can tell you that they're rethinking a lot of the decisions that they made, and it's unfortunate we cannot turn back time.
While there is still a lot to understand, the best way forward is to continue protecting yourself and others.
If we can take care of each other, it will be very, very far in between those that will struggle with long-lasting body effects, lungs, kidneys, heart, brain. But if we do not observe all of these precautions and we roll the dice, chances are that somebody's going to draw a very short straw, and we don't know who that is.
In Grand Rapids, Angeline McCall, Fox 17 News.
And Dr. Cambo-Nicelli says that right now, an estimated 1% of all cases will remain on breathing devices or require acute care for the rest of their lives.